in 2025 with a management degree and a double master's in public administration in 2014 and business administration in 2016. He also earned a Bachelor of Arts in Management in 2011 from the same university. He has diplomas in management and HR management. He was CEO of Vanimo Hospital and West Pacific Provincial Health Authority prior to entering politics in June 2014 to February 2015. He has earned an advanced diploma in critical care specialist nursing in operating theatre and emergency from the College of Allied Health Sciences in 2000. He has a certificate in general nursing from the Rabaul School of Nursing in 1992. So he is not foreign to your profession. May I ask you to please join me in welcoming Honourable Minister, Honourable Kapavore, to the podium to do this address.
Good morning. Good morning, everyone. I acknowledge the Prime Minister of our country. Let's put our hands together for the Prime Minister. Thank you very much. Donald Trump for coming. He's got some commitments this morning. He's able to make some time to be with us. Thank you very, very much. I acknowledge the President of the Medical Society, Professor Tevorani, the Regional Director, WHO, Dr. Saya Dukala. Thank you very much for coming to our country and especially for this important program today. I acknowledge some special people here, Professor Waters as well. I was doing a good care in 1999, Allied Sciences. Dr. Warangi, I was looking after the operating theatre for some time at Vanimo Hospital, and I had the privilege of working with some of these important people who are seated here today at the front. Professor Isikevao and Dr. Chalau, and all of this. Thank you for those important experiences we have had together. The development partners today who are with us here, DFAD, ADB as well, they are important partners of the health sector. I acknowledge you, and the team from UPNG, the Chancellor and the Vice Chancellor for being here today with us here. So it's an honor and profound responsibility to address you today at this landmark 59th Annual Symposium of the Medical Society of Papua New Guinea. We gather under the transformative theme of One Health. We stand at a unique union of celebration and commitment. We celebrate by honoring 60 years of medical excellence, while also commemorating our nation's Golden Jubilee this year. As the Minister, I'm deeply moved by this dual milestone, this parallel journey of our medical societies, 6 decades of dedication in our nation's 50 years of sovereignty. This reminds us that the story of Papua New Guinea's health system is inseparable from the story of our independence and self-determination. Our government's commitment to the One Health approach is reflected in the concrete strategies outlined in the National Health Plan 2021 to 2030. This comprehensive plan, with the key result areas, provides the roadmap for the transformation of our country health system over the next decade. KRA1, just remind everyone, on our KRS, we have 5 KRS in the health system that covers or guides the way we implement health services in our country. KRA1 emphasizes on the need for healthier communities through effective engagement. We are empowering communities to take ownership of their health and well-being. Through strengthened community health programs and enhanced health promotion initiatives, we are ensuring that health decisions are made at the grassroots level, where they matter most. This aligns perfectly with a One Health approach, as communities are the frontline guardians of human, animal, and environmental health. Key result area 2 emphasizes on working together in partnership. Our partnerships extend across government sectors, civil society, development partners, and the international organizations. The establishment of the Papua New Guinea University of Medicine and Health Sciences, and I want to say thank you to our government for endorsing this important way forward. Let's put our hands together for the important institution that now paves the way for a standalone University of Medicine and Health Sciences. Result area number 3 emphasizes on the increasing access to quality and affordable health services. We are systematically addressing the barriers that prevent Papua New Guineans from accessing healthcare. Our investments in the rural health infrastructure, mobile health services, the telemedicine initiatives, and bringing quality healthcare closer to every community. Our Prime Minister said this when he was launching the National Health Plan back in 2021, and he said that all our citizens have fundamental rights to healthcare. They must have access to a health facility that is of quality wherever they are within 1 hour reach in any mode of transport. And that is our challenge. That is a key policy statement that is now captured by the Department of Health, and many of our partners are supporting this important initiative. So we are particularly focused on strengthening primary healthcare, which forms the foundation of our healthcare system. I had the privilege of going to Mohed, that's Western Province. It's about 3 hours flight from here. I had the privilege of going to Amutintrekekia along the Sipik River. I had the privilege last week to go to Gloucester, in the remote part of Karen Gloucester in Western New Britain Province. There is a transformation happening right now at the primary healthcare level, and supported by our partners. I want to say thank you to ADB. Let's put our hands together for them. We've had the Government of Australia and our government that is now emphasized, and we now have a health infrastructure plan that we will launch today to see that we are doing things collectively in unison, and everyone have only one plan that guides us going forward. Key result area 4 addresses the disease burdens and targeted health priorities. Our approach to disease management embraces the health or One Health framework. We are tackling communicable diseases like, as we know, TB is an ongoing concern in our public health system, primary malaria, HIV/AIDS, while simultaneously addressing the rising burden of NCDs. Our integrated surveillance system monitoring disease patterns across human, animal, and environmental interfaces. The key result is building a robust, resilient health system that can respond to current needs and future challenges. This includes investing in health workforce development. I want to announce today the NEC also made a decision to establish what we call a Health Services Commission in the health sector. So we don't have to go through, in the future, we do not have to go through PPM anymore. Operations through health sector today. The Department of Education, they have up to 60 to 70,000 workers. Health, we are only struggling at around 20,000 workers at the moment. And we need up to more than 30,000 workforce today. There are many of our graduates who are graduated from different health institutions who are still out there looking for jobs. And only the system will work when we have our health graduates being posted right across the country, starting off at the primary healthcare level first, and making their way back to the level 5 and level 6. And that's the way forward for the health department. So that means we will establish the Health Service Commission, similar to the Teacher Service Commission going forward. Department of Health, at the moment, we are putting a structure in place to establish a task force that is now implementing the particular arrangement. So we are building a robust, resilient and health system that can respond to current needs and future challenges, as I've said. This includes investing in health sector workforce, the supply chain, the medical service equipment, and the government structure that support the effective health system delivery. The One Health approach demands collaboration across sectors and borders. We are strengthening our partnership with neighboring Pacific nations, sharing expertise and resources to addressing common health challenges, climate change, emerging diseases, and the environmental health needs of threats that do not respect national boundaries. We just had polio virus coming back from Indonesia. That's an example. And the environmental health threats do not, as I've said, we must have a responsive system in place and coordinated. And I think the government also, last parliament, there's a biosecurity system or biosecurity system or law that is now in place, and we have a support from the government of Indonesia, Minister for Health. We'll establish a biosecurity system at the border, and I thank the Secretary of Agriculture who is here today that we can take this on board together. To our international partners present today, I express our deep gratitude of your continued support and collaboration. The expertise you bring, the resources you provide, and the partnerships you maintain with us are essential to building health security for our region. To our dedicated health workforce throughout the nation, the 22 provinces, or 96 districts, we thank them. I want you to know that your government recognizes the values, your extraordinary contributions that you work today supporting our people, often in challenging conditions, to protect and improve the health of our people. We are committed to supporting you through improved working conditions, and I acknowledge the DPM and our team department for signing lately NDA award. There's a new award coming through, and that award specifically emphasizes the need to have doctors, specialist team going back to the rural community, starting off there first. That's a new one. The new medicine, University of Medicine and Health Sciences will provide continuing education opportunities, ensuring that our health workforce remains at the forefront of medical knowledge and practice. Let this 60th symposium mark not just the celebration of past achievements, but the renewed commitment to our future. Let us embrace the One Health approach as more than a concept. Let us make it a foundation of everything we do in the healthcare. To the medical professionals gathered here today, you are the custodians of the vision. Your research, your practice, your advocacy, your leadership will determine how successfully we implement the One Health approach in our country. To our international partners, we invite you to join us in this journey. As you've done in the past 49 years, in the future, we will continue to do this together. Sharing expertise and the commitment to building health security of our Pacific region. To all Papua New Guineans, I call upon you to recognize that health is everyone's responsibility. The members of parliament, DDAs, the local level government arrangements, every one of us are part of this system. The One Health approach reminds us that the choices we make about our environment, our communities, our lifestyles all contribute to health outcomes we achieve as a nation. As we embark on the deliberations of this historic symposium, let us remember that we are not just discussing health policy or medical practice. We are shaping the future health and prosperity going forward in the next 50 years of our nation. The One Health framework gives us the tools to address complex, interconnected health challenges. Our commitment and collaboration will determine how effectively we use these tools. May this symposium generate new ideas, strengthen existing partnerships, and forge new collaborations. May our discussions lead to practical solutions that improve health outcomes for our people. And may our collective commitment to the One Health approach guide us together towards a healthier, more prosperous future for our nation. I thank you all again, every one of you gathered here together today, for your dedication, for improving health in Papua New Guinea. Thank you for your participation in this landmark symposium. And I thank you all ongoing National Department of Health, with our government, continue to stand committed to supporting the health outcomes that are coming out, or the recommendations to come out from this important workshop. Thank you, everyone. God bless all of us today. Thank you.